And welcome back to Talk of Alabama. Do you ever have pain in your fingers or hands? If so, it may be a painful condition called trigger finger. So right now, I have Dr. Colberg here. He's from Andrews Sports Medicine. We welcome you to the show.
Thank you for having us.
Okay, I've never heard of this prior to this interview. What is trigger finger?
Trigger finger is one of the most common conditions that happens in the hand and the fingers. And what it is basically a tendon that starts getting inflamed and irritated. Now, there is a ligament in your hand that holds that tendon against the bone. And when the tendon starts getting swollen, the ligament doesn't really allow too much space for that ligament to get swollen. So the tendon starts catching with that ligament. And so the patient eventually starts feeling a painful click or catch or pop. And the problem is that within about 3 days of onset, the tendon is swollen enough that then it starts catching. And the more it catches, the worse it gets because it's getting more and more irritated.
Okay, so who are some folks who would be perfect candidates for trigger finger? What occupations? Can you list some?
So the most common patients that get trigger finger are people who use their hands a lot for work. So we see it in manual laborers, construction workers, carpenters, and so forth. We also see it a lot in musicians. Playing the guitar, the violin, they use their fingers a lot. We see it a lot in preschool teachers and elementary school teachers because they're using scissors to cut things. And now we're actually seeing it in people using smartphones and texting because they're just, texting away using their fingers a lot.
We were talking about this before we came back. I mean, we have a whole generation of young people who have, basically been bored with the phone, essentially. Kids are getting phones younger and younger and younger. I mean, I have some cousins who are in elementary school and they have cell phones, And so you're right, they're constantly texting or on Facebook, Instagram. And so do you think that you're going to start seeing more patients who are younger dealing with this?
We do expect to see more patients coming in, especially affecting the thumbs. And it used to be that the main tendons were the middle finger and the ring finger that would see it the most. But I do think that we're going to be seeing more of trigger finger in the thumb because of the texting.
I would imagine also people who like to crochet or knit would probably deal with this as well.
Yes, ma'am.
Okay, so let's talk about treatment. How can you get relief from trigger finger?
So once the tendon starts getting inflamed and irritated, it's very important to treat the inflammation as soon as possible. Because the quicker we get that inflammation to go away, the better chance we have to prevent the tendon from getting swollen and catching. So we recommend taking an anti-inflammatory and seeing the hand therapist that can rehab the hand. Sometimes we use a splint. In some cases, we'll do a cortisone injection. But unfortunately, most people, when they come in to see the doctor, it's too late at that point. And the tendon has gotten swollen, and now it's catching and popping and clicking. And the only option that we had up until recently was doing an open surgery. So we would go to the operating room and make an incision, and then cut the skin and the fat pad, and then we get to the ligament and release that ligament. The problem is that then the patient would have to deal with sutures for 2 weeks, and typically it would take about 4 weeks to return to work.
Oh, wow. But now you have something, a small needle, right, that you can use that will also relieve that pain?
So there's a new procedure that's been introduced in the last few years that I've been doing, and what it is we use the ultrasound machine. It's the same machine that we use to look at babies when they're born, but we have certain adaptations that we can look at very small structures, and we will find that ligament that surgically will go in and cut, so you can see it with the ultrasound. And then we have this tiny little needle that has a knife at the tip, and you just make a small little puncture in the skin, and you advance the needle under ultrasound guidance, and you can see it live. The patient can see it, and you can cut the ligament and release it, so then it heals in a stretch position. So we achieve the same thing that we used to do with the open surgery, except that now the patient doesn't have to worry about sutures, about wound care. Less downtime, so the patient has a Band-Aid for 24 hours, and they return to work within 7 days.
Wow. We thank you so much for coming on the show, Doctor. Their website's listed at the bottom of your screen if you want some more information. We appreciate it. Very fascinating.
Thank you, ma'am.